Hi, and welcome everybody.
Hi, Sofia. I am Eszter Kismödi, and I am the Chief Executive of Sexual and Reproductive Health Matters.
COVID has really hit all of us personally and professionally. And I've been starting these conversations by asking basically, how has COVID affected you personally? In what ways has it been relevant to your life in a personal way, if you don't mind my asking?
Thank you for the question, Sofia. I'm okay, and my loved ones are okay. We are really worried about our Indian colleagues and friends who are facing a devastating situation. I think the biggest challenge for many of us that we don't know what is coming, to face the uncertainties that COVID brought to our lives, and not knowing when it ends and what comes next. But personally, it also brought some good things. I learned how to prioritize between my private and professional lives, and how to drop everything to support those who are in need above all.
That's amazing. I wish you could teach me about that balance between the private and the professional. So what about in terms of the issues that you work on, and in terms of kind of for Sexual and Reproductive Health Matters as an organization, but also for the communities that you work with now? Like, what's your sense about how COVID is relevant to the issues that you work on and that you care about so much?
I think a good thing for our organization have been that SRHM has been a virtual organization working online for many years now. So we were able to respond to the pandemic very early on and document, and we realized that actually how evidence and rights-based knowledge and analysis is crucial to the response. We were able to document about how supply changed for contraceptives and medical abortion, and, for example, HIV medicines were severely affected and obstructed. But at the same time, we are also continually being able to report about the positive measures, how telemedicine and self-care interventions are working. We are also documenting the false assumption that how increased technology and self-care intervention and communication can reach all. We quickly learned that it does not take necessarily account these interventions, how certain people, for example, people with disability, those with, for example, hear and visual impairment, or adolescents in many circumstances, don't have access to these services. We are also being able to document how COVID-19 enhanced intersectional discrimination. These are big words, but they are really realities for marginalized communities. Or also how, for example, those whose safety and health is already jeopardized because of criminalization, such as sex workers and trans and gay communities, are facing further life and health hazards because of the pandemic and the obstructive measures that are imposed by government.
You have this kind of global view because of where you sit and the work that you do. And so, I wonder if you could talk a little bit about some of the policies that you see that you think are of most concern globally within countries. I leave it to you, but I think there's so much happening right now, and I would really like to hear from your perspective.
I would love to talk about two things that starts from theory, and we realize that it's such a practice. We teach and we talk about the Syracuse principles. I mean, these are principles in the public health field that are set to examine whether and how governments can restrict human rights. And these are the Syracuse principles that we use in public health and human rights terms. From very early on, we really learned how to apply, for example, these principles and how these principles are applicable. For example, it talks about proportionality and least intrusive measures. And we really learned about politics, that how the respect and protection of human rights really depends on the government will. We learned about how the governments are using their power to restrict sexual and reproductive health services and dismiss scientific evidence, while others are really introducing good practices and facilitate services. As a researcher, as a teacher, as a health and human rights professional, I just suddenly realized that whatever we were talking about through our lectures and through our teachings and through our programmatic efforts suddenly became such a reality. Unfortunately, another reality also hit us, that how governments are using their power, their unlimited power, because of the crisis situation. And talking about my own government, the Hungarian government, who just passed the law last May, making it impossible for transgender or intersex people to legally challenge their gender, putting their life and health in risk and subject them to further discrimination and violence. So I feel that we really learned a great deal about the politics of public health.
Totally. I mean, I totally hear you, and how governments have used COVID as an excuse
Absolutely.
in order to restrict and violate rights in ways that are hugely beyond anything to do with COVID, like your example from Hungary. I mean, there's a lot of bad. There's also, I think, some good. And I wonder if you've seen some examples of some good, examples of what the governments or what the UN system have done to effectively address COVID. I mean, are there any positives that you've seen?
I personally was very impressed, for example, by WHO, how WHO stood up very early on, considering sexual and reproductive health services as part of essential services. I think it was such an important step in order for countries to make up their own policies and regulations. At the country level, and it really shows through our articles that we are publishing, that the crisis presented an opportunity for rapid regulatory change and legal change and program innovation that we thought to be only possible through rigorous, lengthy processes. We always get the response for legal and policy change that, yes, but it takes years, yes, but it takes a lot of time. And now we have the examples for countries but we are advocating for such a long time. For example, eliminating requirements of mandatory waiting periods for safe abortion services, or suspending criminal penalties for self-managed abortion, was possible in a couple of weeks' time or days' time. I think the other positive change that we also see and document is how effective partnerships can work. We published an article from the experience of Mary Stops last year, when Mary Stops in Nepal documented that how they worked with ambulance services and local foundations who are set for installing hand washing stations, but they agreed on to transport sexual and reproductive stocks to pharmacies and remote locations. And despite of other examples, we also saw how the funder community stood up and became flexible and trust their communities to decide what is the priority for the given community. So this partnership engagement, I think it's a definitely very positive practice that we could observe in the past 18 months.
I hear you, and I also think, I really hope that these are lessons that we can carry forward, so that as we move into like a post-COVID moment, that funders will remember that they were able to trust that, that all of these things can happen in a way that I think, I mean, it's super important what you're saying. And so I think there's a lot of lessons that we need to document about what's there and what can carry forward. I think my last question to you is really about, as a society, what do you think that we can learn from the experiences of the past year? I mean, are there lessons, are there things that you think we need to keep in mind, just to kind of have the big picture of kind of like where we are and where we're going?
I can think about 3 levels, maybe starting to state the obvious, that we should take a moment to examine the weaknesses of our health system and strengthening in the health system, but not only from the public health perspective, but also from the human rights perspective, and really realize how public health walks hand in hand with equality, non-discrimination, dignity. From the knowledge creation and research perspective that I'm investing in, I think we should finally learn, and this past year showed that real impactful interventions can work if we work hand in hand with the communities, and how it works and how much it actually matters when we have limited resources. At the personal level, I think I was watching your previous interviews as well, but I think what keeps bumping up is solidarity. And, you know, I'm coming from a communist, post-communist, post-socialist country when I was a happy pioneer, and solidarity was a slogan that I grew up with. And I think since my pioneerhood, I didn't experience so much, or haven't experienced so much than this year. What does this mean? Solidarity at the societal level and also at the personal, individual level.
That's hugely important, and it's hugely important. I hear you. I thank you, and thank you, Eszter. That was super helpful and wonderful.
Thank you so much, Sofia.